Do puberty blockers improve mental health for transgender teens? Have you ever wondered how puberty blockers can affect the mental health of transgender teens? This topic is essential for understanding the journey of many young individuals. Puberty blockers, which are medically known as gonadotropin-releasing hormone analogs, serve a specific purpose. They pause the physical changes that occur during puberty for transgender and gender-diverse youth who have started this process. These medications work by suppressing the production of sex hormones such as testosterone and estrogen. By doing so, they prevent the development of secondary sex characteristics that may not align with a young person's gender identity. This can be a game changer for many teens. Research has shown that using puberty blockers can lead to better mental health outcomes for transgender adolescents. Studies indicate that those who receive these medications report lower levels of anxiety, depression, stress, and suicidal thoughts. They also experience fewer behavioral and emotional problems compared to their peers who do not receive this treatment. For instance, transgender youth who start puberty blockers early in their puberty journey tend to have fewer mental health challenges and better overall psychosocial functioning. This is a significant finding, as it highlights the importance of timely intervention. Puberty blockers are often the first step in gender-affirming medical care. They give transgender youth the time they need to explore and solidify their gender identity without the distress caused by unwanted physical changes. This delay can significantly reduce gender dysphoria, which is the psychological distress that arises when a person's assigned sex at birth does not match their experienced gender. Gender dysphoria is a major contributor to mental health issues among transgender youth. By alleviating this distress, puberty blockers can play a vital role in improving mental well-being. Most young people who begin puberty blockers eventually transition to gender-affirming hormone therapy. This therapy helps develop physical traits that align with their gender identity. However, the timing and progression of this care are tailored to each individual. Medical guidelines support the use of puberty blockers as part of gender-affirming care. They highlight the role of these medications in enhancing mental health and overall well-being. In practical terms, puberty blockers can provide transgender teens with relief from the distress of unwanted changes during puberty. This can lower the risk of depression and suicidal ideation while improving emotional and behavioral functioning. They are considered a safe and reversible medical option to support the mental health of transgender youth during a critical time in their lives. So, do puberty blockers improve mental health for transgender teens? The evidence suggests that they do, making them an important option in the journey of medical transition and gender-affirming care.